So for those who have joined our Instagram lives in the past, like most things in DBT, we like to begin with a brief mindfulness practice. Again, the intention is that I think for a lot of us, I can speak for myself. It's been a long day. There's a lot that I am probably thinking about what happened, and a lot about I'm thinking about in the future. So mindfulness, we can sort of ground our attention just in this present moment. So I'm going to invite everyone on our chat here, as well as those who are listening, to take a moment. You can either lower your gaze or close your eyes, whatever you feel most comfortable with. And I'm going to invite you just to bring your attention to your breath in this moment. Notice your inhale and notice your exhale. Wherever you feel it most present. Notice any thoughts about the future and bring your attention to the breath. Notice any thoughts about the past and bring your attention to the breath. And when you're ready, you can open your eyes if they were closed or raise your gaze if it was lowered. And let's get started. All right. So I'm very excited for today's Instagram Live. Before we get into all of the rich discussion, I would love to do some quick introductions. So I'll begin with myself. I'm Jesse. My pronouns are he, him. I am a clinical psychologist and co-founder of TheraHive, as well as a DBT therapist. And I'll pass it over to you, Alicia.
All right. Alicia, Dr. Alicia Smart. And I am clinical director of a DBT center in California, Northern California, and also co-founder of TheraHive. And I am actually meeting you two lovely, of she, her pronouns, lovely people today. So either one of you want to start next. I'm excited to meet you.
Yeah, I'm Xannie. I am the creator and host of the BPD Bunch. I started DBT in 2017 as a patient and graduated in 2019 for borderline personality disorder. I stopped meeting the criteria probably like 3 years ago. So, yeah, I'm excited to be here and talk all about it. Lena, over to you.
Yeah, my name is Lena, pronouns are she, her, and I am a DBT client turned DBT therapist. So I was also admitted into a DBT program and graduated. I still see my DBT therapist though, because I don't want to let her go. And became a DBT therapist myself a few years ago. So.
Oh my gosh, congratulations.
That is amazing. I love to hear that. That like warms my heart so much when I hear people going through this journey and then not only becoming therapists, but to your point, like not meeting criteria anymore. And that's the thing I think is actually not fully understood by many people seeking treatment for BPD, is that it actually is incredibly treatable. Like I've seen many people go through DBT and not meet the criteria after having a full 2 years in a DBT program. So it's inspiring, it's exciting. I hope more people can feel hopeful, and seeing that. That's awesome.
Yeah.
So I think sort of along those lines, I think that there are some folks who are joining us who perhaps this might be their first encounter or experience with even the acronym BPD and the acronym DBT. So I wonder if we can even begin with just the basics, like from both a lived perspective as well as from a clinical perspective. How would you all define and conceptualize borderline personality disorder?
Oh, yeah. Yeah, all the acronyms. So I
Yeah.
think at this, I think at this point in my career and as a person with lived experience who's sort of like, I've don't no longer met criteria, which doesn't make sense because BPD is supposed to be a personality disorder, so it's like who you are, right? First, I'm a little bit on the radical side in terms of thinking about diagnosis. So I think I really see BPD as a trauma disorder. Yes, not everyone who has BPD has necessarily like criterion A trauma, like big scary trauma events. And yet, like in DBT, we talk a lot about this idea of like a chronically invalidating environment, and I've never met someone who hasn't at least experienced that. But BPD, the way we really conceptualize it is that it's a sort of like pervasive difficulty with emotional regulation. And so that also comes with a lot of other things in the bucket. It's quite a complex diagnosis, especially for those of us like, I think Xannie and I share in common. I met all 9 criteria. So I was a full package BPDer. And so that, came with like psychotic seeming episodes and the classic sort of fears of abandonment, anger issues, et cetera, et cetera. So it's, I think, a pretty complex disorder to really sum up, but that's my best attempt at just giving the nutshell of it.
Yeah.
I just want to dog ear because I want to come back to this. Two really important like things that I wanted to dig into. One, the idea of BPD being a personality disorder, and two, this idea of invalidation or traumatic invalidation. So holding those things in mind. Xannie, I want to pass it over to you.
Yeah, I mean, I don't have a whole lot to add except that I think thinking about it in terms of emotion dysregulation was really helpful for me, because I think as somebody who has always had very loud, big emotions, I'm not very good at hiding how I feel. I think that was where a lot of invalidation came in. And instead of learning how to deal with my emotions effectively, I just got dysregulated, right? And so like one of the things that I think in terms of BPD as from a lived experience perspective is the difficulty is not in the emotion itself, but in the way that we regulate them. So like how I, am I spinning myself out of control or coming back to a place where I can use, my whole self, my logical side and my emotion side, and I'm not just letting my emotions run away with me. And so I think that's been really helpful for me in terms of thinking about what BPD is really that emotion piece. And I mean, I think also secondarily, relationships. Relationships are such a key part. And to quote you, Lena, BPD is developed and maintained through relationships. It's also healed in large part through relationships. So, yeah.
Yeah, I mean, it is. Oh, go ahead, Alicia, please.
Well, I was just thinking about that also, like how it's so interconnected with the emotional dysregulation too, right? Because oftentimes the environment becomes more invalidating in response to the big emotion because it doesn't understand them, it doesn't get it. It's like, why are you acting this way, right? And then even if they mean well, they become more invalidating, right? And then there's this fear of like, okay, I'm too much, I'm not lovable, I'm not worthy, right? Or people are going to leave me, people are not going to get me, right? And then that, can kind of also make us more dysregulated. So it's like all of that interconnectedness that happened. And I'm thinking about some of the other criteria around like fear of abandonment, right? Or this idea of like not knowing, confusion about self, right? Well, it's hard to know who we are and like have a sense of identity when we're feeling so at the whim of our emotions, right? Or feeling the emotions are so big. So I think those all do. I like to think of it as an emotion dysregulation disorder too, not a personality disorder, to your point, because it is treatable. It's a very treatable disorder. So yeah, I don't know if you were going to say more about that, Jesse.
I am curious to hear from Xannie and Lena, like, I'm about to say something, and I wonder how this sits with you. But I've always really struggled with thinking about, like, I'm not terribly comfortable with the idea of a personality disorder. Like, I don't believe that, like, somehow our personalities are quote unquote disordered. And Lena and Alicia and Xannie, you two, you all highlighted that we exist in relationship to others, that our dysregulation happens in transaction to, let's say, an invalidating environment. And there's something about calling something a personality disorder that sort of puts the entire responsibility on one individual rather than acknowledging the context in which that individual exists.
Yeah.
I'm curious how that sits with you both.
Yeah.
I mean, yeah. Well, I mean, I think personality, I think the reason why we choose that word is because these are kinds of things that are relatively pervasive in multiple areas of life, and it's harder to isolate like specific contexts, and that may be why the word personality was chosen, because you know the way we define personality is sort of as something that is pervasive in multiple areas of life, right? But I agree that it doesn't really quite fit, because it is, a lot of it is in transaction, and even though it may be pervasive, there are, you know, to me it always seems strange that people didn't recognize that there are specific contexts in which it is activated and specific contexts in which it's not, right? It's not I am just bananas walking down the street like angry all day or going up and down. It's all in my interactions, you know, and it's not only with other people, it's within myself, right? Like we have relationships with ourselves as well.
Mm-hmm.
So, but yeah, I don't know what the word should be, but I agree that personality is probably not the best choice.
Yeah, I think, you know, thinking back to like my grad school days when, you know, we really learned about this idea of like ego syntonic versus dystonic, right? And like people with personality disorders, that's who they are. It's not just the symptoms they're struggling with. I think that, yes, the idea of a personality disorder is very outdated. I think that some people want to throw the personality disorder diagnoses, you know, out the window entirely. And that was why for me, I didn't really recognize that I had BPD until I was 29, because I was like, oh, there's no way. This is such a messed up idea anyway. But I'm still dealing with something that was a little bit more than just like some anxiety or depression, right? And so, yeah, I think like we're in a time where we're seeing our perspectives of diagnoses in general and all these things really evolve as we go along. And so we're kind of figuring that out with BPD as well.
I mean, I am curious, like, if there was another way, or, you know, and Lena, for you, in terms of how you talk about it with your clients, and for both of you, having had lived experience, is there another way that you would prefer it being described or referred to as? Or do you feel like, because I do know some folks who have been diagnosed with BPD who are like, no, like it's BPD, this is it, and this is like, and there's a sort of a sense of empowerment that comes with having that clear diagnosis. I'm wondering for you, like how does it sit?
Yeah, I think it's hard. It's a hard question because I think like it really gets into the dialectic of what is disorder, period, right? Because you know, I definitely relate to. I mean, we have the BPD bunch. Like there's something with, you know, the label that's really validating, and for me was really like, oh my gosh, yes, this is what's happening, right? It's not just like this random coincidence of things happening. Like I'm dealing with this thing called BPD, right? And like the other side of the dialectic is that I really struggle with the idea of calling anyone disordered when we live in a world that's so disordered beyond one individual person. And so, I think that's where I struggle with knowing, and I also have a hard time with coming up with words for things. I named my practice after my dog because I was like, cool, I love my dog. She's great. Um, so yeah, I don't know if I'd be the one to be like, yeah, here's the word for this.
Yeah, I have a similar challenge because when I think about my journey with the label itself, I was diagnosed as a teenager I was diagnosed several times, but the first time somebody brought it up was when I was 15.
Wow.
And at the time I was kind of like, screw you guys. It took me a long time to accept it. And then at some point it became almost like I had a name for this demon I'd been sharing my body with, and that felt, especially at a time when I didn't really have the skills to take ownership for that demon, it was helpful to separate myself from it. But then as I moved along in my recovery, I feel like that only takes you so far. At some point you have to recognize that, like, my BPD didn't do that, I did. Like, it is all within me. This is all connected, it's all part of myself. But then it's like, but it is only a part. I don't know. Like, the word personality really does make it sound like this is your whole thing. And, even like on our cast, we have 17 people, right? And there is definitely a lot of overlap with a lot of our experiences and the way that we act, but there's a lot of differences too. Like, we are not all carbon copies of each other. We have a lot of different ways in which we interact, likes, dislikes, traits. And not that the MBTI really has a whole lot of scientific validity, but it was interesting. I don't know. I think emotion dysregulation disorder is up there on my list of things, but I don't think that quite encompasses everything either. So, but I do think that the label is helpful to some degree because it helps connect people with similar experiences. Not having any labels is hard, because then, like, we wouldn't be having this conversation, because we wouldn't know that we had this shared experience to talk about in the first place.
And I think I want to highlight what I love about the BPD bunch and what you two like is that there's sort of a reclaiming of it. Like, then because we have this term, there's an opportunity to sort of like make it into something else that is not stigmatized, which I think is pretty beautiful.
Yeah.
Alicia, what were
absolutely.
you gonna
Like,
No,
go ahead.
Yeah, I wasn't going to add to that. I was thinking, I mean, I love what we're all talking about, because I do think that there is a dialectic, and I was really appreciating holding that dialectic and even the diagnosis itself, right? Because on the one hand, everybody's experience is different. And even within, people who identify as having BPD, their lived experience is going to be different, right? And also having a label to understand sometimes can be really validating and useful for treatment too.
Yeah.
Do you want to get to some? I saw a few questions in here. I did see something about bipolar, but did you have other questions that you wanted to make sure we got to, Jesse?
Yeah, so I think I have it's sort of a question, but also a question that we received from an Instagram user, and I'm sort of also curious another aspect to it. So the question was like, how do you go about looking for a effective DBT treatment and resources? And I guess perhaps for some folks who are coming to this new, don't have any knowledge of DBT, I'm wondering, Lena, Xannie, and all of us, like, would you all mind just sort of, for you all, like, what is your understanding of DBT? How would you define DBT to those who are listening in?
Do you want to go, Xannie?
Yeah. Well, I mean, there's sort of the book definition of DBT as a treatment modality, and it's sort of the synthesis of holding two seemingly opposing truths at the same time, the yes and. But I think for me, like, I I was a therapy kid. I spent a lot of time in different treatment programs. And when I was in a partial inpatient hospitalization program, there was, I was part of like a group therapy where they handed out some DBT skills sheets for parts of it. And there's like, here are some things that you might find helpful. And so I left that program thinking I'd done DBT. And it did not help me at all. And I had a breakdown and which my family came out to help me and try to figure out, and they had looked into what actually made like an adherent DBT program. And some of the things were like the group skills class, which is very different from group therapy. Like for me, being in more of like an organized sit down, we're going to learn these skills. We're going to talk about it so that we make sure we understand what these things are. In a group setting was really helpful because there were a lot of different examples, but there's also guidelines that, it's not like a process therapy that's to do one-on-one with your individual DBT therapist. And that was really helpful. I think having homework was really, really useful to me because I think this is a challenge for a lot of people with BPD. A lot of us are very intelligent. We can, and for many of us, we get to a point where we're self-aware. We understand all these things and how they went wrong, but it doesn't help you in the moment when you're having an actual breakdown. And so having homework, things that I could do, and being able to call my therapist in a crisis moment was probably the single most helpful thing, because all I had to get myself to do was dial a number when I was in crisis. I don't remember any skills. I just dialed the number, and my therapist would help me use the skills that I had learned in treatment. And so to me, like all of those things combined are what makes a really effective DBT program. And, it's not like someone really motivated couldn't get something from a sheet. Like I know that there are a lot of great self-help DBT books out there, which are super helpful. But I think you do also have to have a lot of strong self-motivation and accountability, which I did not have at, like 21. So I think all of those things together really help people become successful in the program.
Yeah, I think Xannie, you bring up a huge point, which is that DBT is more than just the skills. The skills are like a huge part of DBT. They're kind of like, the pot that everything else kind of mixes together in, and it's a multimodal treatment with, all these other tricks and things that we do as therapists. But just to add to that without repeating anything, like I think for me, what really, again, like Xannie said, what really got DBT to work for me is I had done like every therapy before that. Literally every therapy. There's very few therapies I haven't done. And having a therapy where my therapist was like, I care so much about you and I am here for your worst moments. And like, I really need you to go get a damn bucket of ice water and put your face in it. Right. Or like my therapist was like, this is what you do in this moment. And I think the part that really stood out to me and still like I relate to as a DBT therapist is this, really the therapists themselves is allowed to be a person, right? Like I had moments where I was BPD is a shame disorder is like the other part of it. And I had moments where I was just like drowning in shame, and my therapist was like, oh my God, I've totally done that before. And it just burst the shame bubble. And that's like, so like not what you're supposed to do in so many other therapies. And to me is like one of the things that, we have these agreements that we agree to as therapists. And, one of them that's really standing out to me right now is the fallibility agreement. You're allowed to just like be a person and make mistakes and like, and so it really allowed for me as a client to also be to make mistakes as well.
Well, and how healing that is to model that, right? To be able to model that and not go into a shame spiral, right? And to be able to be like, yeah, like we make mistakes, right? We're all human. And that can be so relieving for a client to see.
I think the one thing I want to add that is important is that in DBT was the first time I had therapists who were really willing who found the dialectic between being there for me and also challenging me. Mm-hmm. I think I got away with a lot where there were a lot of therapists in my early days who like leaned too heavy into just listening and validating and not really challenging my dysfunctional beliefs or the myths. And my therapist has done a really good job of finding, like, knowing when to poke and when not to poke. I remember last year I had one realization and she was like, oh, finally we can talk about this. I've known this was a thing, but I knew you had to be the one to bring it up first, so now I can challenge you on it. And I was like, okay, great. So I think that was probably also instrumental, that having someone to challenge you really makes a difference.
Yeah.
I mean, so what I'm hearing is like a whole bunch of things. And for those folks who are coming in, it's, when we think about the quote unquote comprehensive DBT, we think of like the big four. Like we think about like the skills group, we think about the individual therapy, we think about phone coaching, and then there's consult team, which is sort of known colloquially as like therapy for the therapists. And what I love that everyone's sort of highlighting here is, yeah, Xannie, like what you sort of identified at the very beginning, the dialectic between acceptance and change. Like having someone who knows how to sort of toggle between validating, recognizing that what you're feeling isn't some sort of abnormal thing, but is human and makes sense. And at times being willing to push back or challenge some of those beliefs to sort of shake our perspective, begin to think a little bit more or just differently about our experience. So I know that some folks were asking, like, how do you go about sort of looking for effective DBT treatments? I mean, one thing that I often recommend to folks is I say, like, ask if the clinician is on a consult team. I think that's one thing that's helpful. Ask if they're offering phone coaching. I don't know, what are some other things that you all think would be helpful for folks to ask when they're meeting a DBT therapist for the first time?
I just went through the database.
Mm.
The Lena certified database was how I found my therapist.
Yeah, that's also a fabulous way.
Yeah, I think if you go to that, like the Linehan certified website and look for providers, you can find both individual therapists as well as organizations that are certified, and that's a great way to find a comprehensive DBT person.
Yeah, it depends on where you are. Like, there's the list is not very long, but like I had to drive an hour outside of town before the pandemic. I had to do that, so but it was worth it. So
yeah, and I think that the reality is that DBT, finding comprehensive DBT is really hard. For one, there's a lack of availability, and it can also be expensive. And so sometimes, I think that working with a clinician who has some level of DBT training is better than nothing. Research shows that even just participating in skills group, people, get more out of that than if they aren't doing any sort of DBT at all, right? And so I always like to lead with that because, like us here, I was very privileged to be able to access DBT, right? And not everybody has that, even if they do have the resources, maybe it's not available in their area or their country or whatever. And so I think that like with DBT, wherever you can get your DBT is better than no DBT. But I think even if you are able to access comprehensive DBT, sometimes different DBT therapists work for different people. Like I really needed a therapist who leaned more heavily on the validation side, somebody who my therapist like eventually like challenged me and, really, kind of pushed me to change and things like that. But she really leaned heavily into really kind of meeting me where I was at and being really validating. And that's exactly what I needed. And some people work really well with having a therapist that's just going to be like, all right, let's do this. Come on, let's go. So I think also really knowing yourself and like what you are seeking in a therapist is really helpful as well.
I want to highlight, we got one comment from a user saying, I'm not entirely, so what you're saying, I think it's what you're saying is our reality is wrong and theirs is right. What is it stopping from the other way of being, the other way around? I'm really appreciative for that question, because I think it speaks to the sort of the heart of DBT, which is that there is no like truth. I mean, there are multiple truths, so to speak. So as clinicians, as clients or consumers, the goal isn't to sort of argue for like who sees reality right. It's being willing to hold that there are multiple perspectives, and these perspectives can all exist at once. And fundamentally, what we're asking ourselves is, how can we work with our emotions and these perspectives to help us move towards our life worth living goals? So it's not about invalidating our experience or telling us that what we're thinking or feeling or behaving is quote unquote wrong. Instead, it's about validating and asking ourselves how we want to move forward. Would you all say, is there anything you all would want to add to that?
Yeah, I think one of the biggest things for me has been like the right versus effective. Like, because there's this like, you know, like, what are we seeing reality correctly? It's like, well, it's more about the outcomes that you want out of a particular interaction or something. Cause like there's a lot of times where, you know, based on all the information you have, you may be objectively as objective as possible correct or right to act a certain way, and the people you're around may react really badly to that. And if that's something you're trying to avoid, then maybe you want to do something else. Like I was in line at security at the airport, and they wanted me to put all my stuff together before going through security to then take it apart. And I thought it was a silly request that would hold up the line and make everyone frustrated with me, which it did. But they're the ones in charge of the line. And I was like, you know what? I'm not going to fight you on this, because even though I'm pretty sure that I am right in this situation and this is just causing more frustration than not, you're the one in charge, and it's not worth it to me to get into it with you.
I love that. That is a perfect example of, do I want to be right or be effective? Because being effective would be like, okay, just following the rules of the person who's in charge, right? Because that's what's going to get you, like, otherwise you could actually cause more conflict or trouble.
Yep.
Yeah.
Yeah.
But yeah, I think like the whole idea of what's effective, I leave that up to the client I'm working with. I'm like, what are your life worth living goals? What do you want in your life? And is this moving in the direction of that? I often, because I'm, you know, in my mid 30s now, I'll have clients that are in their early 20s, and like their life worth living goal is like to go out and have a good time. And I'm like way past that, as I'm like falling asleep on the couch crocheting at 8 p.m. So I'm like, you know, if that's what your life worth living goal is, great. Let's figure out what's effective behavior for that. And like, it might not be my reality. It might not make sense for me, but that's okay, because that's not what I'm here for, right? It's all in the service of, you know, what your life worth living goals are. And, you know, there are going to be times where, yeah, maybe what you're doing isn't in service of that. And I'm just going to bring us back. Right. But it's not that I'm telling you you're wrong or that you're bad or you're doing something, you know, naughty that you're not supposed to. Like, I hate, never want to be in that role as a therapist. All I'm really here to say is, hey, you know, I'm just thinking about what we've been trying to work on, you know, as your life worth living goals. And this doesn't really seem in alignment with that. Like, what do you think? You know, it's really up to the client. And that's one of the things I really love about DBT is it's not, I'm not making your goals for you.
Yeah, I think I think a comment about that too, that it's a collaborative treatment, right? It's not like I'm the authority and I'm going to tell you how to live your life. Like, I'm actually partnering with you to help you build the life that you want.
Yeah, what my therapist said to me when I first started with her, and I steal it and tell my clients this, is, you know, I'm like your road trip buddy. So sometimes like I'm the one holding the map, and sometimes you're holding it, and sometimes I'm driving the car, and sometimes you're driving the car, you know, but like it's really where we're trying to go is where you're wanting to go. So I'm not the one who's in charge of where we go. I'm just helping us get there.
Nice.
So.
Yeah, I'm gonna attribute that to you. I love that. I'm gonna be using that. I mean, and I think that is you know, like, and it's something that I often tell clients. I'm like, I suffer as well. Like, we all suffer. I think that there's this idea that, like, I, I think historically therapists have occupied like this strange place. There's been this really powerful power dynamic, and that to some extent intensifies shame for a lot of folks. And I think the more that we can communicate that we're all human, we're all suffering, we're all trying to figure this out. You and I are just figuring out your stuff together here.
Yeah, totally.
I'm gonna check the additional questions that we got in advance. Okay.
While you do that, Jesse, I did
Yes,
want to
please.
circle back to we did make where TheraHive made a navigating DBT free course. It's on the TheraHive website. So if anyone is trying to like figure out the whole DBT thing and like the different options for learning DBT, there is a free course available.
Oh, that's super helpful.
Along those lines, so we got a couple questions. Yeah. One question is, do I need to be diagnosed with BPD to participate in DBT treatment? No. My perspective is no. I believe that these are life-living skills. I believe that everyone, I don't want to make, that sounds undialectical. I believe that many people could benefit from learning these skills. I wish that these skills were taught. I wish when I was like 8 years old, I could have learned some of these skills. I don't know. What is all?
Yeah.
What is?
Yes.
Totally.
Well, when I was going through DBT, my parents were like looking at the book and they were like, "Oh, this would be useful like for most people. Like everybody should do DBT. Like it looks like it'd be, like everyone I know that doesn't have BPD who I've ever like talked to about DBT or I've explained a skill, they're like, "Oh, that seems really useful." And I'm like, "Yes, it really is."
Yeah. Yeah. I mean, I think DBT was originally sort of developed for people with BPD or emotion dysregulation or whatever. And that's kind of made it, because BPD is so stigmatized, people see it as, oh, DBT is it's like the BPD therapy. And I love when like I have a chance to talk to my fellow clinicians who aren't DBT therapists and explain what DBT is, and they're like, "Oh wow, that seems really helpful." Because yeah, I agree with you, Jesse. They're life living skills.
I mean, and I like want to like Marcia when she was developing DBT, she like pulled from everything. Like there's so much in there, and fundamentally, DBT is it's sort of like teaching you to be the orchestrator of the symphony of your emotions. Like how do you sort of work, and that is something that all of us like we like, at least personally, I did not grow up in a culture that taught me how to navigate, sit with, regulate my emotions. And I just feel like fundamentally, like as a society, like we need this.
Yeah.
I don't know.
Yeah.
Alicia, anything you want to?
No, I mean, I'm just echoing what everyone else said. I do think of them as life skills that the majority of us can benefit from because I use them every day. I mean, I'm constantly using DBT skills.
Yeah.
I wonder if so Frankie one of the users followed up who asked about the question. And again, I love this question. I wonder if one of you all can sort of respond to this. Firstly, no, I just want to speak to this person. No, you're not being negative. I think you're asking really helpful questions. It's this person saying, hey, it sounds like you just have to squash all your feelings and conform to quote unquote normality, and then you will be okay to some extent. Xannie, can you please speak to that?
I have very strong feelings about this because sometimes there are certain things even now that I may do where someone looks at me and they're like, most people don't do that. And I'm like, okay, and if I'm not like, the goal is to get you to a place where you feel confident and competent and in control of your own life. I think so many of us with BPD feel like there's something else inside of us that is running the show, where we're not really in control of what's going on. So DBT more puts you in the driver's seat so that you are the one in control of all of that. And like there are certainly some areas in which my emotional intensity has decreased, but that's largely because the emotional intensity was a reaction to maladaptive beliefs that I no longer hold. But I still have really intense emotional experiences to life, you know, like the thing at the airport. Like I trying very hard not to just like lose my shit at people because it just seemed so inefficient. But it was like, you know, it's not my show, I'm gonna get through. So it's like, it's a balance. Like I'm able, when I need to, I can appear a certain way because it's effective, because I choose to, right? Because in my mind in that moment I was like, if I lose my crap on these people, like I might not make it home. Like they might pull me out of the airport and say, well, you're not flying, right? And that was not a consequence that I was willing to deal with. So I sort of was able to use my skills and get myself together to get through security. But I can make that choice because I'm now able to look ahead and see what are the potential consequences of my behavior. And there are still times when I might quote unquote lose it, but it's because, you know, most of the time it's because it's something I'm deciding to do, right? It's not something that's doing it out of my subconscious.
Right. So you feeling like you can actually make that choice as opposed to just the emotion kind of like taking the show, and the emotion is driving the car, right? Like you're actually being like, okay, you know what? This is the thing about DBT too, is that there's a dialectic in the types of skills that are taught, right? Like some skills are about reducing the intensity and bringing down our emotional intensity and like not acting on our feelings sometimes if we choose to. But some of them are about actually feeling our feelings, right? And expressing them in ways that are effective. So it, you know, it depends on like what's going to work for you. Again, that goal, where am I going?
We got,
Yeah,
oh, Lena, please go ahead.
I was just gonna say, I think I'm like seeing little clips of comments as they go up, so I'm not catching them all. But I think I saw a user, Ryan something, I think address what I would want to say, which is that like it's not about squashing down your feelings, it's about like learning how to tolerate them, right? So you can respond and not react. And like I remember early on in DBT myself, I would say to my therapist, like, am I just going to be this like not like numb kind of normie? Am I just gonna, because I identified so much with my emotions, and I still do. I think my emotions are what make me who I am. I'm an incredibly sensitive person, and I see that as a gift now. And my whole reality does not rotate around my emotions, and not because I want to make other people happy by squashing down my emotions. I choose to sometimes manage my emotions a little bit differently rather than just kind of experience them at 100% and react to them, because it doesn't make me feel good, and it doesn't help me live the life I want to live. And so again, you know, like some people are going to, you know, go through DBT and say, screw it, I'm still going to be super emotional and I might be kind of rude and whatever, you know, and like if that's what you want out of DBT, heck yeah. Like it's, you know, it's experiencing your emotions in the way that makes sense for you.
I to add on that, like it's so nice doing these Instagram lives because like you get these really beautiful comments. Zen the Cosmic Cowboy responded, it's not squashing your emotions, it's witnessing and honoring your emotions without judgment so you can get your nervous system regulated and make a conscious and intentional choice to act while remaining in your integrity without shame.
I like
So that is beautifully
Yeah.
put. Thank you for that.
Yeah.
I folks, this has been such a pleasure and an honor speaking with you two. I can you talk like I for those who maybe have coming first time hearing about the BPD bunch, can you talk a little bit about your respective works, etc.?
Yeah. So the BPD Bunch is a video podcast that started in November of 2022, and we have a panel of people who are in what we call functional recovery. from borderline personality disorder, and each week a few of us get together to discuss various BPD related topics. And usually the first half of every episode is sharing relatable stories or what it was like when we were really struggling with something. And then towards the end of the episode, we talk about different ways that we have learned to manage these different contexts. And yeah, and when we say functional recovery, there's, we actually did an episode with Dr. Lois Choi Kane, and she was talking about that there are a lot of people who, achieve like a symptomatic recovery, where they're not, obviously symptomatic, especially in like the self-harm and suicidality criteria. But that for some people, it's due to avoidance of triggers or activators. They just sort of are like, I'm going to lock myself away. And that's not really living a meaningful life. And so functional recovery is getting to a point where you have the agency and the autonomy to create the life that you want for yourself. And, within that group, there are some people who still identify with the label BPD. I oscillate between those things. It's hard to completely detach myself from it because I feel like, once you've had it, it's hard. You look at things through that lens, even though I don't technically fit it, but yeah, and we have a diverse group, and it's really fascinating to see all the different ways that people have come to manage. So yeah, we just wrapped up our 4th season.
And I will say that, like, for clients that I've worked with, like, it's been a godsend. Like, it's really incredibly validating to hear other folks navigating. I'm so appreciative of your work. So I really just want to say that.
Thank you.
Wait, there's something. Oh, and I just love that point that you just made a moment ago about the functional recovery. Like, Marcia sort of described sort of progress in DBT treatment as like a house. And like, once you get to like the second stage of the house, like, you're so afraid of falling back down into the pit that you spend all your time sort of avoiding things. And to your point, and Lena, like, I'm aware of like the work that you do with PE and trauma, and you were mentioning trauma before. That's oftentimes when we start thinking about sort of like trauma interventions and so forth. I don't know why I'm adding this, but you just made me think about those things. Yeah.
Well, it's like the stage 2 is all about quiet desperation, and I think a lot of us, we might not be in that like emotional reactivity, real dysregulation space, but life in general is pretty isolating, but especially when you deal with BPD and people in your life might not understand it or validate, or might be abusive or whatever, harmful as a result. It's really great to have a space where it's like other people are like, yeah, I deal with this, and they come from all walks of life and everything. So I'm very grateful for Xannie for setting that up and having that idea. I think you've created an amazing thing, Xannie.
Thank you. Well, I'm glad to have you there because I think it's, your experience as someone with lived experience and being a clinician is like, you bring the best of both worlds, which it helps us to have a lot more, it's not just the lived experience. We balance out the clinical side as well, which I'm very grateful to you for. It would be hard to do it without you.
Oh, thank you.
All right. Alicia, any last words that you want to ask our 2 wonderful, amazing guests?
I mean, I'm just curious actually how you guys got started. Like, you're in your 4th season, but how did it all start? What was the beginning?
Well, I actually started back in when I was first on Instagram, and when I decided to tell people about my diagnosis, I was in the middle of my DBT journey, and I was sharing about that. And I, long story short, learned through various relationships that I developed that there's something to the whole peer experience, hearing from other people and using that sort of those anecdotal stories of what others have overcome to use to yourself. And I knew that I wanted to do some kind of a show, but I've always been a little bit self-conscious over the fact that the trauma that I've experienced was not big T trauma. It was, very, in childhood, it's just like I was like a kid with ADHD who didn't get treated for that, and then, learned maladaptive coping stuff that turned into BPD in adolescence, right? It's like, it was hard to feel like, people who come from really dark, abusive backgrounds, how would they relate to me? And you know, I'd only be able to reach people with my exact story. So then I thought about shows where you have like all these different archetypes of people from all different walks of life. And like, you can have a group of friends together and each person identifies with a different character. And then I thought, well, why don't we just create that for BPD? Because if we can get enough people together who have all different kinds of stories, then we can prove that no matter who you are, where you've been, or where you're going, it's possible to get better. And so we have members of our cast who are in functional recovery, have never done BPD specific treatment. At best have done talk therapy, you know. And like getting that was really important to me because yes, a DBT is great. It saved my life. And as Lena pointed out earlier, it's not always accessible to some people. And so I just, it was important to me to show that it really, no matter who you are, where you've been or where you're going, you can get better. It is possible. It's not guaranteed.
I love that because I think that it's so important to be able to hold on to that hope, especially when people are struggling so much because it's easy to fall into hopelessness. And I do think the power of groups in general, that's one of the things I love about teaching groups and running DBT skills groups, is even in the skills group, like members hearing from each other, like how they're using skills. And then like when certain like more elder menders, I should say, who've been around for a while, like kind of like being able to show the newbies in the group, like, hey, I was there, you know, a couple months ago. Here I am now, right? It's just inspiring. Keep people going.
And
it's such important work.
We still learn stuff from each other. You know, one of our cast members, Georgette, she had this great thing, like affirmations are so hard for so many of us. And one episode she's like, well, one of the things that's really helped me is I put what if before an affirmation. So instead of saying I am strong, it's like, what if I was strong? What if I was beautiful? What if I was intelligent? All these things. And I was like, wow, that makes affirmation so much more accessible to me. I'm going to try that. Right?
I like that.
So that's just one example of like a lot of the things, because we do come from all these different backgrounds. So we get new things all the time. And I think that's really cool because it just brings a really well-rounded view. It's not just one thing. There's a lot of different paths and you can take little bits from all these different things to create what works for you.
This is amazing. I wish we could keep on talking for much longer, and maybe we can do this again. I would love that.
Oh, yeah.
That would be great.
Absolutely. There's always more.
There's always more. It's endless. It's endless. Thank you both so much for taking the time. This has been wonderful. Thank you for everyone who joined for this live. We will have a recording of this. We'll share it with you all. We'll share it on the TheraHive. We'll share it on
YouTube.
On wherever you can find the recording of something. Thank you.
Well, and also I encourage people, if you have more questions you want or would love to see another Instagram, like just put, you know, make some comment on our page and we can get another one going.
Yeah, I know we had one about like partners in DBT we didn't get to, so we gotta like.
Oh, I know. I was holding that in mind.
We gotta do another one.
Next time, I would love to. We need to talk about that.
Because I have an answer for that one.
Yeah.
All right.
So part
me too.
2. So folks, you're hearing it. Part 2 will be partner. Oh yes. Okay. Cool. All right. We'll see you all soon.
Okay.
Sounds good.
All right.
Bye.
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 Bye.